Hi, my name is Allison Pierce. Thanks for joining us today. I am a member of the communications team at the Fairfax County Health Department. And today we are here to discuss school immunizations. And I can tell you, this is a really important topic to me because I am a public health worker, but also I am a mom to a rising fourth grader and a rising seventh grader who attend the Fairfax County public school system. So I certainly need to ensure my ducks are in a row to prepare my children for that first day of school. So that's what we're going to dive into today, the school immunization requirements that are needed. And to discuss this topic with us is Shauna Severo from the Health Department. Shauna is our Director of Health Services, and she oversees the school health program, our health clinics, and basically any patient-facing service that the health department offers and other things too. So Shauna, thank you so much for bringing your experience and knowledge on this topic today. So let's go ahead and dive in. So the health department issued some information this week urging parents to get on it when it comes to school immunizations and not to delay them. Why is there this urgency?
Well, first, I'd like to say good morning and thank you for this opportunity, Allison. As you know, the public school system's first day of school is August 23rd, so the clock is ticking. And if parents wait too long to get their vaccines, it may actually delay their entry into school. So we're encouraging parents not to wait until the last minute, but to schedule their vaccine appointments now. We also know that over the last year, due to the pandemic, many of us may have delayed getting routine checkups or health care to include vaccines. And so we may be behind in our vaccine updates. So it's very, very important for parents to contact their pediatrician or the health department to find out what their child needs in terms of vaccines and to make sure that they get their appointments now and not wait until the last minute. Additionally, we have some new vaccine requirements this year for school. And we'll talk a little bit about that later. But that is going to increase the demand for vaccine appointments as well. And so with the trying to get caught up and the new vaccine requirements, it's really important for parents to take action now and not wait until the end of the summer to get their appointments, because that really could impact their child's ability to start school on time in the fall.
Great. And I want to mention, we just saw a graphic on the screen that details a calendar for COVID immunizations. We're going to talk about that later. That is separate from school immunizations. But right now, I really want to dive into this topic of getting those school immunizations updated. You mentioned that there are indeed some updates to that schedule for some students. Could you please detail those for us?
Sure. So there are two new, they're not new vaccines, they're new requirements for school entry. And effective July 2021, Virginia Code does require these two additional vaccines for school entry. And the first is the meningococcal vaccine. Now, this vaccine protects individuals against a bacteria that causes meningitis. And this is an inflammation of the lining of the brain or the spinal cord, and it also can affect the bloodstream. It's very serious illness, and it can progress rapidly. So an individual could be healthy, but within 48 hours become seriously ill. And it can also cause some long-term disabilities to include loss of limb, hearing impairment, or brain damage. So it's a very serious illness. The first dose of this is required prior to entry into 7th grade. And the second dose would be required prior to entry into 12th grade. The second immunization or vaccine that is now required for school entry is the human papillomavirus, otherwise known as HPV. And this virus can cause late in life or later in life cancer. and it can cause up to, there are several different types of cancer that this virus can cause, to include cervical cancer, penile, anal, and throat cancer. So the vaccine does protect. It's really the only vaccine we have that does protect us against different forms of cancer. The first dose of this vaccine should be given prior to 7th grade, and the second dose should be given within 6 to 12 months after the first dose. So we do know that prior to 7th grade, we need to have the meningococcal and the HPV. Now, I know that there is some discussion around the requirement for HPV. The code does say that it is a required vaccine for school. It does also say that if parents, upon review of the information, make a decision not to vaccinate their child, they may choose to do so. But of course, as a public health professional, I highly encourage parents to get their child vaccinated.
So for my son, who's the rising 7th grader, it sounds like the meningococcal and the HPV are the new school immunizations, and I'm happy to report I recently updated him on those.
Good for you.
I am ready for that first day of school, and let me tell you, I can't wait.
You and a lot of other parents, I'm sure.
I think so. But I did want to mention, the meningococcal vaccine. I know I personally, and I think many people out there know people who have had this infection and have sadly passed away very suddenly from it. It is scary. I know, and
it's
like
a very
I said,
serious illness. Yes,
and quick.
Yes, as I said before, from healthy to seriously ill to potentially fatal within 48 hours. And I don't know if I mentioned, it is required prior to 7th grade, and then the second dose is also required before entry into 12th grade.
Right. And then with the HPV vaccine, if I'm not mistaken, as you said in your remarks, this prevents several types of cancer. As far as I know, it's the only vaccine on the market that's a cancer preventative.
That's absolutely correct. And so as a parent, it's critical that we take advantage of that opportunity to protect our children against cancers that could occur much later in life. But this is an opportunity to provide them that protective measure now.
Great. And I know some parents out there ask about the HPV vaccine and in sort of the framing of, well, if my child is not sexually active, is this necessary? What are your thoughts on that?
Well, as I said, it's a prevention measure, right? And we want to provide this protective measure prior to any time that an individual or a child, or not a child, would be an adult, would engage in sexual activity. So the time to do it is now, before an individual is sexually active.
Great. Well, thank you for sharing all the details about these new school immunization requirements. Let's talk a little bit and share some advice for parents on how to get them completed. How do they go about doing that? How do they go about getting their child updated on their school immunizations?
That's a great question, Allison. And first, we would recommend, if you have a pediatrician or a family doctor, reach out to your doctor and schedule an appointment for your medical provider to review the immunization records and provide the appropriate vaccines. Now, of course, if you don't have a pediatrician or a family physician, the health department does provide vaccines, and we can also link you up with a medical home. So first, I would recommend seeking out your pediatrician, but if you don't have one, then please contact the health department and we can provide those vaccines for you.
Great. And I want to mention, and it's on the screen now, that health department number to make an appointment for vaccine is 703-246-7100. So, parents are busy. I speak from personal experience on that, and it can really be difficult to find the time and to organize just your family's logistics to get vaccination completed. So is the health department offering any special services to help parents out in that regard?
Yes, and I do want to just mention that I think all healthcare providers are very committed to increasing access to these very important protective measures. And so the health department does have extended hours. We have hours Monday through Friday from 8 to 4:30, and extended hours on Uh, Tuesday till 6 o'clock. And then we are also offering some weekend hours. I would also mention, though, that a lot of pediatricians and family healthcare providers are also extending hours. Many of them have early morning hours, evening hours, and some even have weekend hours as well. So I encourage you to reach out to your medical provider or the health department to find out about the availability of appointments. And in addition to that, I do want to mention that we do understand that many families are working and parents are working and may not have the opportunity to come in during the operational hours. And so parents do have the option of sending their child into the health department or to get their vaccines through their private provider with another parent. So that would be somebody who's 18 or older and has been given permission by the parent to take their child in to get vaccinated. So this could be a caretaker, a babysitter, a family member, or another trusted adult that the parent has given permission to bring their child in to get vaccinated.
So just to summarize, it sounds like the health department has extended some hours, specifically on Tuesdays until 6 p.m. to help accommodate working parents a little bit more.
Yes.
And then also there are some weekend hours available, but call for that
Yes,
information.
absolutely.
And that phone number again is 703-246-7100. And then also at the health department clinics, a parent can send their child with a caretaker who is 18 or over,
Yes.
who the parent has given permission to
Yes.
oversee that vaccine appointment. So these are good conveniences, I think, for parents. So I want to talk a little bit about appointments. You know, in the past, I know the health department clinics had walk-in hours for that. Those aren't available this year. People must make an appointment. Can you just share a little bit more about the importance of that and what's
Yes.
happening?
Well, we have decided during COVID, which many healthcare providers have done, to offer only appointments, and that is because we want to make sure that we're maintaining social distancing and we're adhering to the recommended mitigation measures. And having appointments allows us to space appointments out and manage the flow in clinic and limit the number of people in the waiting room or at the registration line so that we can still maintain social distancing, because it's very important for us to protect our clients and our staff.
Right. And these are healthcare settings.
Yes, that's right.
So these are places where there are COVID-19 health and safety protocols very strictly and safe. It's very strictly in place, rather. And this is true across all healthcare entities at this point in time, I believe. So again, it's so important to call today and get that appointment and make sure that you as a parent are taking care of this now so that it's done in time for school. So
Allison, could I just make one point, though, too?
Sure.
We are a healthcare facility, but it is important to note that we are not in the business of treating people with COVID in the same clinic setting where we're providing immunizations. So I do know that some people have been fearful of going to their medical providers for fear of exposure to COVID, and that is not likely to happen in our setting. I just wanted to make a note of that.
No, that is very important because I know it's all on everyone's minds still, and it's good to know that those health and safety procedures are very much in place.
Yes.
So I do want to talk a little bit about COVID and about the COVID vaccine. So we know now that the Pfizer vaccine is available for adolescents ages 12 and up. That is the one on the market that is available there. Is this required for school?
It is not required for school, but obviously, as a public health professional, I do recommend the vaccine so that the 12 and older are able to go to school and be protected against the vaccine, because science has proven that this does protect individuals against the COVID-19 and the other variants that are circulating in the community at this time. I will say that if you are interested in getting your child fully vaccinated prior to school entry, you need to act now, because with Pfizer, which is the only one that has been approved for the younger children, it is a 2-dose regimen. And to be fully vaccinated, you have to have one dose, a second dose 3 weeks later, and then you need to wait a full 2 weeks after your last dose to be fully immunized. So if you want to have that done prior to school, then it's important to get your appointments now.
Great. And everyone can see the graphic on the screen that kind of shows that. So we're coming up on that Monday, July 19th, as the day to get that vital first dose in for those parents who are interested in having their children fully vaccinated against COVID-19 prior to the first day of school, which is not required for school, but public health does recommend it for people who are indeed eligible for it. So and I just want to mention, for people out there who might be interested in the COVID vaccine, whether it's for your child, your aunt, your uncle, your grandmother, yourself, go to our website, which is fairfaxcounty.gov/COVID-19. You'll see the vaccine information pinned right to the top of that page, and you'll be able to go there to look for appointments and things of that nature. So I wanted to share that as well. So we have covered a lot today about school immunizations and immunizations in general. So Shauna, I know you have spent most of your career,
Yes.
if not your entire career, in public health. You are a nurse, you are a mom. And I just wanted to ask, from that perspective, and that career perspective, why are these vaccines so important?
Well, as a 40-year public health nurse veteran, I firmly believe the most important thing a parent can do to protect their child and to keep them safe is to get them vaccinated. Look at it like this. As a precautionary measure, before you get into a car, you buckle your children in. Even though you don't expect to get into an accident, right? You take that precautionary measure. So as a parent, another very important precautionary measure that you can take is to get your child vaccinated to protect not only your child, but other children against very serious infectious diseases that are preventable.
Mm-hmm. Yes, great. Well, thank you for that perspective. And we do have one question in the chat that perhaps we can address, but before we sign off, and for anyone who has submitted questions, we are coming to the end of our time here. So I apologize if we can't get to everything, but we will follow up with you separately with your questions. So this question is to just go over the ages again for the two vaccines for school we talked about, the HPV and the meningococcal.
So, different people enter 7th grade and 12th grade at different ages. So I will review. The meningococcal and the HPV should be given prior to 7th grade at age 11 or 12. The HPV is 2 doses, so it would be 1 dose prior to entry into 7th grade, with a second dose 6 to 12 months after the first dose. And then the meningococcal would be the second dose of the meningococcal should be given prior to entry into 12th grade or around age 16.
Perfect. Thank you. So, and thanks to the person who submitted that question. I do want to say all of this information that was presented today can be found on the Fairfax County Health Department website. That website is fairfaxcounty.gov/health. If you need to make an appointment at one of our health clinics for school immunizations, as Shauna has reiterate it several times here for us today. Now is the time to get it done. Don't procrastinate. Get it off your family's to-do list today. To make that appointment, please call 703-246-7100, and a member of our team can help you out. So, Shauna, thank you so much for going through details today. I think that it's been very helpful for everyone out there, and we really do appreciate it. Again, if anyone has any questions about school immunizations, just go to our website. There's information there with links to information from the Department of Health and the Centers for Disease Control as well. And of course, if anyone has any questions about COVID-19, whether that's the disease, vaccine, whatever, you can find that information on our website, which is fairfaxcounty.gov/COVID-19. So Shauna, thank you again. And thank you to all of our friends and neighbors out there. And we hope to be back online and doing this a lot more. So thank you so much, and we'll see you next time.
Thank you, Allison.